The Chicago Studies. Consistent with his philosophy of science, Rogers did not permit methodology to dictate the nature of his research. In his investigations of the outcomes of client-centered psychotherapy, first at the Counseling Center of the University of Chicago and then with schizophrenic patients at the University of Wisconsin, he and his colleagues allowed the problem to take precedence over methodology and measurement. They did not formulate hypotheses simply because the tools for testing them were readily available. Instead, they began by sensing vague impressions from clinical experience and gradually forming these into testable hypotheses. It was only then that Rogers and his colleagues dealt with the task of finding or inventing instruments by which these hypotheses could be tested. The purpose of the Chicago studies was to investigate both the process and the outcomes of client-centered therapy. The therapists were of a journeyman level. They included Rogers and other faculty members, but graduate students also served as therapists. Though they ranged widely in experience and ability, all were basically client-centered in approach. Hypotheses research at the University of Chicago Counseling Center was built around the basic client-centered hypothesis, which states that all persons have within themselves the capacity, either active or latent, for self-understanding as well as the capacity and tendency to move in the direction of self-actualization and maturity. This tendency will become realized provided the therapist creates the proper psychological atmosphere. More specifically, Rogers hypothesized that during therapy, clients would assimilate into their self-concepts those feelings and experiences previously denied to awareness. He also predicted that during and after therapy the discrepancy between real self and ideal self would diminish and that the observed behavior of clients would become more socialized, more self-accepting, and more accepting of others. These hypotheses, in turn, became the foundation for several more specific hypotheses, which were operationally stated and then tested. Method. Because the hypotheses of the study dictated that subtle subjective personality changes be measured in an objective fashion, the selection of measuring instruments was a difficult one. To assess change from an external viewpoint, the researchers used the Thematic Apperception Test, TAT, the Self-Other Attitude Scale, S0 scale, and the Willoughby Emotional Maturity Scale, EM scale. The TAT, a projective personality test developed by Henry Murray, 1938, was used to test hypotheses that called for a standard clinical diagnosis. The S0 scale, an instrument compiled at the Counseling Center from several earlier sources, measures anti-democratic trends and ethnocentrism. The EM scale was used to compare descriptions of clients' behavior and emotional maturity as seen by two close friends and by the clients themselves. To measure change from the client's point of view, the researchers relied on the Q-sort technique developed by William Stevenson of the University of Chicago. The Q-sort technique begins with a universe of 100 self-reference statements printed on 3x5 cards, which participants are requested to sort into 9 piles from most like me to least like me. Researchers asked the participants to sort the cards into piles of 1, 4, 11, 21, 26, 21, 11, 4, and 1. The resulting distribution approximates a normal curve and allows for statistical analysis. At various points throughout the study, participants were requested to sort the cards to describe their self, their ideal self, and the ordinary person. Participants for the study were 18 men and 11 women who had sought therapy at the Counseling Center. More than half were university students and the others were from the surround community. These clients, called the experimental or therapy group, received at least 6 therapeutic interviews, and each session was electronically recorded and transcribed, a procedure Rogers had pioneered as early as 1938. The researchers used 2 different methods of control. First, they asked half the people in the therapy group to wait 60 days before they would receive therapy. These participants, known as the own control or wait group, were required to wait before receiving therapy in order to determine if motivation to change rather than the therapy itself might cause people to get better. The other half of the therapy group, called the no-wait group, received therapy immediately. The second control consisted of a separate group of normals, who had volunteered to serve as participants in a research on personality study. This comparison group allowed researchers to determine the effects of such variables as passage of time, knowledge that one is part of an experiment, the placebo effect, and the impact of repeated testing. The participants in this control group were divided into a weight group and a no-weight group, which corresponded to the weight and no-weight therapy groups. Researchers tested both the therapy weight group and the control weight group 4 times, at the beginning of the 60-day wait period, prior to therapy, immediately after therapy, and after a 6 to 12-month follow-up period. They administered the no-weight groups the same tests on the same occasions, except, of course, prior to the wait period. Findings. The researchers found that the therapy group showed less discrepancy between self and ideal self after therapy than before, and they retained almost all those gains throughout the follow-up period. As expected, the normal controls had a higher level of congruence than the therapy group at the beginning of the study, but in contrast to the therapy group, they showed almost no change in congruence between self and self-ideal from the initial testing until the final follow-up. In addition, the therapy group changed their self-concept more than they changed their perception of the ordinary person. This finding suggests that, although clients showed little change in their notion of what the average person was like, they manifested marked change in their perceptions of self. In other words, intellectual insight does not result in psychological growth. Does therapy bring about noticeable changes in clients' behavior as perceived by close friends? Participants in both the therapy and the control groups were asked to supply the experimenters with names of 2 intimate friends who would be in a position to judge overt behavioral changes. In general, the friends reported no significant behavioral changes in the clients from the pre-therapy period to post-therapy. However, this global rating of no change was due to a counterbalancing effect. Clients judged by their therapists as being most improved received higher post-therapy maturity scores from their friends, whereas those rated as least improved received lower scores from their friends. Interestingly, before therapy, clients typically rated themselves less mature than their friends rated them, but as therapy progressed, they began to rate themselves higher and, therefore, more in agreement with their friends' ratings. Participants in the control group showed no changes throughout the study in emotional maturity as judged by friends. Summary of results. The Chicago studies demonstrated that people receiving client-centered therapy generally showed some growth or improvement. However, improvement fell short of the optimum. The therapy group began treatment as less healthy than the control group, showed growth during therapy, and retained most of that improvement throughout the follow-up period. However, they never attained the level of psychological health demonstrated by normal people in the control group. Looking at these outcomes another way, the typical person receiving client-centered therapy probably never approaches stage 7 hypothesized by Rogers and discussed earlier. A more realistic expectation might be for clients to advance to stages 3 or 4. Client-centered therapy is effective, but it does not result in the fully functioning person.